in theory, that disc that has become sequestrated should ultimately be phagocytosed or whatever it is that it happens to it. But how long that takes, where it ends up resting, how big it is, are all probably more important questions than necessarily whether it's going to reabsorb over time or not.
Yeah, I do remember Nick Birch again was talking to us before about the fact that most bulging discs will resolve by themselves if you give them long enough.
95% of bulging discs will reabsorb.
Yeah. But it might take a bloody long time. It'll be very painful in the process.
And you will hear more and more now, certainly in kind of the medical community, so doctors and surgeons, they really are not that interested in doing anything unless 6 months has elapsed between the onset of symptoms, radicular symptoms. Yeah. So you can have raging radicular arm pain or leg pain, and the surgeon will say to you, let's give it 6 months and see what happens. They're not racing into surgery and interventions as they were at one point, because 95% of these problems will resolve spontaneously.
Right, and their reluctance is because rather than get you out of pain quicker, potentially they risk the surgery going wrong? Well,
spine surgery is always complicated and is never without risk. So even in the hands of a good surgeon, there are risks of bleeding, infection, nerve damage. Yeah. You know, and do you want to subject a patient to that when ultimately, if you can tide them over with medication and appropriate exercise and appropriate treatment, you can buy them enough time to allow the process of healing to occur and reabsorption to occur. So that's the emerging view with most surgeons and doctors now, is don't rush into doing things if you can keep somebody kind of going for 6 months and allow it to resolve itself. And often it'll take less time than that.